morning, Commissioners.
Good. How are you?
So after we prepared for our comprehensive plan, we wanted just to kind of bring our office to the spotlight for you to let you know what we are doing. So the comprehensive plan also showed us that we have a ways to go in collecting our data. So we have tightened up the shores for that. So some of what we have here, it will show that it's not a complete picture because we weren't tracking some of those things. Now we are. So next year's data will hopefully look even better and we'll have more of it. So do you want me to go through page by page? Or do you have any questions?
I think if you just want to hit the highlights and kind of just go and you want to skim through some of them. And
Okay. So the biggest highlights for us is that we are processing a lot more bodies than we traditionally have. A couple of years ago, court administration refused to do any more traffics. So our office has to monitor all those traffics. So that was about 248 more bodies, I think, that came through. So you have to understand those, the mic is on. Is it not loud? Got it closer, better?
yeah.
So we have about 248 bodies that are just traffics that are not probation cases. So part of we tried to make it a win-win, is we did charge a probation fee for those cases, which for us was easy money. We could just pull that in. Now, probation fees are going to be sunsetted in 2025, so we are not going to be collecting any money from those people. All those fines will go to the state. And it has been a lot of work for our front staff. That's 248 cases that they wouldn't usually have to open. And it's front-end time and it's back-end time. So we're going to try and figure out a way to monitor that better. This is also our first year of doing felonies reduced down. That has always gone to the Department of Corrections. And we had 69 of those cases, which is really a full caseload that we absorbed with our agents. And as you can see, our caseloads are very high. We are about double what the recommended amount is for caseloads. So now, after we have our stats, we're going to take a look in July as an office and figure out how can we serve our people better. We're not serving them very well right now. You can't have 110 people on your caseload and manage that very well. There are so many obligations that agents have. It's not just a court order anymore. As people know, probation is changing in Minnesota, so we're going from a traditional more law enforcement to a coach and case planning. So with that, it's not just checking off the boxes of that court order, it is getting people able to survive and thrive in the community, that they don't come back into the system. And that means a whole case plan when you look at housing, you look at education, you look at food, those kinds of things. Are those needs being met so that they can reach their probation obligations? So we are in this big shift now within our department and within the state. It's happening across the state of shifting that. Our agents are behind in training. They're catching up. So our goals as an office were collaboration this year and getting up to date in training so that we are more evidence-based and that we can provide more of those services in-house for our clients. So right now I have a couple agents who are providing a COG skills class. We have one agent who is providing carry guides. Well, 3 agents, both juvenile agents do carry guides, which is skill building within their appointment. So when they meet with a client, they work on a skill. And then they can verify that skill in our tracking system, that they have worked on that with that client. Plus, we're going to have things built into our tracking system that's going to help us hook into other service agencies that we're providing those avenues for people to figure out food security, housing, all of those kinds of things. So we are in a big shift right now within corrections. As you know, Minnesota was paying one of the least. I think we had the 5th highest on supervision, and we were paying one of the lowest per person. And we're also looking at incarceration. Most of the people in our jails and prisons are there on violations. And so now, before we can violate, we have to prove that we have 4 rewards to 1 sanction. So by the time we're sending somebody to jail or prison, we are very clear that we have done all of these steps to avoid that. So we are in a time of change, which is exciting. It's a lot of work. Agents have been great about stepping up to the plate and getting trained, and it's a change in the philosophy of some of the old timers. So that's it, we're creating a culture change also within our office. So it's an exciting time. So I'm open to questions, whatever you need to know.
Just a couple. So it really sounds, if I was to compare it to anything else, it would be to HHS case management.
Correct.
So is there levels of what we're required to do that can be done by administrative assistants versus the officer as far as the social determinants of health, the housing, the food security, those pieces? And is it like I guess I could also compare it to school where you do an IEP for a kid. Is it like you're doing an IEP for this person for probation, for?
Yes. But you have to remember, in probation, we look at criminogenic risk factors. So those are our first priority, are those criminogenic risk factors, and then the case plan follows under that. So we're looking at more than just that. We have to deal with those risk factors, and that we're trying to do in-house with as much as we can, because people don't have money. I mean, we have limited programming in our county, so we are trying to do as much as we can in-house right now. And also trying to develop relationships with service providers that we can say, hey, we need this, would you be willing? We've talked to Wabasha about teaming up on a domestic violence programming. It's just hard for institutions to stay solvent when they're providing this programming for us. So when we look at administrative things, we need to look at that for those low-risk people. Those are the people that don't need an officer. Most times they will not come back into the system. So if we can put less work into those low levels, put them at more on an administrative, then we can focus more of our time on those higher risk. So that's what we're looking at as far as administrative, is how are we gonna work with our numbers more efficiently.
Go ahead, Linda.
Can you give us a couple examples of one, skill building that you're working with them, and two, some examples of the high risk category?
Well, those of you who know our juvenile agents, I mean, those are really high-risk kids right now who have difficult families, and there's not a lot of resources for them. So, actually, I think, Linda, you and I had talked about the child who was in the hospital in Wisconsin. Linda
Yes.
had gotten some calls on a child being in the hospital in Wisconsin. I checked, it wasn't on our caseload. We now have that child. So the child is in the ER. She spent 30 days in an ER in Wisconsin. Her grandmother supposedly has custody. She refuses to get her. The child refuses to go home with her mother. So she's kept in this ER. They did a body-only warrant in Dakota County for, she had an assault. They're now living in Goodhue County. She appears in Dakota County. They hold her in Dakota County Juvenile Services Center. They bring her to us. Child refuses to go home, wants to go back to Dakota County. Dakota County says we don't have a bed for her. Now she's a Goodhue County resident, right? So we don't have a bed. She has a bed if she's a Dakota County resident. She doesn't have a bed because she's now Goodhue County. We have no place to put her. So I have a juvenile agent working all over Memorial Weekend because we put her on GPS and the girl's all over the place. Refuses to go home. Mom's calling saying, pick her up, pick her up, pick her up. We're like, we have put no community resources in there. We've done nothing. And so, and that is a case, she doesn't have a diagnostic. She doesn't have, the family has done, they've been here a year in Goodhue County now. They've been here a year. They've done nothing. They haven't set up any assessments. They want somebody else to take care of it. So that juvenile agent is now, working to get a diagnostic done. We don't have a bed for her. She's not going anywhere. So the agent is on the phone with the parents all weekend long, trying to talk them down, saying, we're not putting her anywhere. And she was on GPS, so we knew she was at the same house all the time, a block away. She just didn't want to be home with her mom. So, that agent worked all weekend long, trying to just keep it together. So for skill building, we have all sorts of things from anger management to what you would do when you're in line and it's not going your way, right? You're asking for help, the person's rude to you, you're not getting your answers. How do you deal with that? How can you stay calm in that? How can you work through that? So it's really simple kinds of things. Anger management, we work with domestic violence kinds of things. It's really everything. How to get your needs met in an appropriate way. How do you navigate simple things in life that we are taught? Most of us were taught as children. These people have not. So, and there's hundreds of skills that we can teach, hundreds. So it's not just meeting with a client anymore, going through, do you have this done? Do you have that done? What do you need help with? It is really, let's talk about this today. Or they might say, I'm struggling in my relationship with whoever, and then we'll say, well, let's talk about this, and you can pull a skill out from that conversation and work on that for 15, 20 minutes with that client.
So in your opinion, or from your perspective, what's the top thing that you feel you need right now? Or top things?
Well, we need, at some point, I'm going to have to come for more staff after we figure out and I think that's going to be on the administrative side, if we can get agents really focused in on those medium to high-risk people and take a look at separating out those lower administrative ones. We have one caseworker who has an administrative caseload right now, so she's opening and closing cases, 700 a year. She's also monitoring 200 to 300 cases. There's just not time. And so if we're trying to figure out, and there's going to be more administrative cases as we figure out how we're going to prioritize.
So basically to try and bring the caseload down so that
the agents can get their work done. It takes them 2 hours for an intake for somebody. We do a risk assessment, we meet with those people, we set up everything that needs to be set up, and then we're either meeting with them weekly, bi-weekly, monthly, and so they're setting that up. I have agents traveling to satellite offices because a lot of our clients can't drive, shouldn't drive. So we try to go out to where they are so that it's easier for them to get a ride into Pine Island City Hall or the Zumbrota Police Department.
Thank you.
So I understand when you talk about caseload per worker, is the caseload numbers just keep elevating? Mm-hmm. So there's not, and the way the courts have changed their guidelines, do you see that continuing at this, or do you see it getting to a point and leveling off? Or is society, culture of society, the people we're dealing with, do we feel like that's just going to keep climbing?
I think it will keep climbing. We've seen a decrease in juvenile crime, just the way statutes have been changed, and we've decriminalized a lot of juvenile things that you could be put on probation for 20 years ago that you don't even see a probation officer for now. I don't see that happening in the adult world. We fine and charge for lots of things, don't we, Steve? I mean, everything now there's no accidents anymore. I mean, we have people on for accidents that are truly accidents, but somebody wants, we had somebody who had a diabetic reaction who pulled out, people were killed, and that family is very, very angry. Well, the county attorney can't charge it out as a homicide. It was an accident, but they got a careless driving. Now we have a very upset victim and somebody on probation for having a diabetic reaction as they're driving.
So what I'm hearing is, as you keep evaluating, it will take more staff.
It will take more staff, and we really have to get better at what we're doing right now, and that's why we're sitting down as an office before we ask for anything. How can we mitigate this the best we can and still provide a good service? And where are the gaps then? If we start to work more efficiently, we have caseloads of 110, 120. Do all those 120 need to be on with the probation officer? We need to take a look at that, because maybe 20% of those could be on an administrative caseload. And you have to remember, we can't transfer cases like we used to. They have really tightened up on what can be transferred. You can see we have a lot of cases that are non-Goodhue County residents that we're monitoring and we're keeping track of. So that has increased our caseload. Every little change that happens tightens us up from what we can farm out.
So that means if you have somebody that from Hennepin County, committed a crime here, and they live in Hennepin County, but they're going to be on the books here, and therefore Goodhue County monitors.
Correct, and there's lots of reasons. Certain offenses cannot be transferred. If you are homeless, you cannot be transferred. We have a large population of homeless people from the cities who end up at the casino and do something. We cannot transfer them. We know what shelters are in the cities. We cannot transfer them. And so then you have a homeless person who's very hard to
Get a
in
hold
touch
of.
with, and you're trying to help them get their things done. And you don't know the services as well in that county. You know, people, so now what we have is agents. We have certain agents who specialize in Hennepin and Ramsey because they have so many of them, so that they can learn those services a little more to help those people. Right. No, we can't.
You probably got to get it over in front of you.
That might help.
That might help, yeah. So is there any magic to it being Goodhue County versus a three-county consortium, or could we, is there room to do, and that's a big lift, and it's not gonna happen, it's gonna take a long time, to do more regional work as far as probation goes? Or is it really because of statute, because of funding, it's county?
It's because of funding, it's county, because all your funding is based on your residency. But states and counties are really good about collaborating. So once a month I'm with other CPO county directors, and we're all talking about what are we doing, how can we do this better, and that's where we have a great relationship with Wabasha. We'll tag team some things together. So it's happening on a different level. It's just not going to happen all the time because of funding.
And it isn't, would it take legislation to change that? Or is the funding from the state, I know we were underfunded, and they made some adjustments. We're still probably not to what it's supposed to be. And there's the difference between the different kinds of probation that counties have? Are all the counties around us similar to us?
Many are similar. There's only 21 CPO counties left. The rest are CCA and DOC. We all operate very similarly, except for the Department of Corrections. And they just have so many layers of management above them. They operate very differently than the other two systems. Okay. But we're all, and I think the reality is it comes down to prevention. We should be spending our money at the front end. When you look at what we have for resources, it's very lacking, but it's lacking across the state. We can't find behavioral health for people. We don't have equity. We have blacks and natives incarcerated much more than white people. We have a long way to go just system-wide to take care of our people and to give them an opportunity. And I've been at the table long enough. I always tell the story. I've been at the table long enough that I've been at the child protection table, and we're talking about these little kids who are in these very difficult homes. Then that little kid grows up to be a juvenile, and we're upset that we're spending so much money on them, right? They're in placement. We're trying to do this. We're trying to do that. It's expensive. And then they become the adult, and they're still in our system, and we don't really want to put any time or money into them. So I've been at the table long enough to see people grow up through this system, and we know what we should do at the first table, and we're not doing it because we don't have resources to do it.
It's always, well, that's the way, I don't know, that's the way some government works. Most government works is we just wait till we have to react. We're not proactive. Mm-hmm. We know that's the right action to take, is to be proactive. We just don't do it. No, so, well, let's wait and see, and then we'll react. And it's totally backwards.
And there's no services. I mean, we're looking for an in-home worker. We have the grant. We cannot find an in-home worker now. I did not think we'd have that problem. I thought we're paying well enough. It's going to be okay. We can't find one. We have interest, but there's no health insurance. There's no retirement. It's a grant position.
So do you see that you'll possibly be coming for staff in this budget round?
No, I think we have to give ourselves a few months to figure out what we're doing first. I think we
No, I
need to
mean,
be more
I
clear.
mean, are you going to be asking for staff in 25?
25 or 26? 26 probably.
So later this summer, before we get to preliminary budget,
Yeah, for 26.
we may have to
I would
talk
think.
about how we can address the issue somehow.
Correct.
Because putting it on the back burner is just gonna, we're just gonna burn more people out and not do the people who need the help any good at all.
Right, we should be really focusing on those high-risk people. And then, any agent will tell you when you watch the news and there's somebody who's in trouble, who's been on probation, and they've done something horrible, everybody holds their breath in the state, hoping to God it's not your client. Like, oh,
Well, it's no different than child protection. You hear something bad happen, hopefully it's not our county, but we should all feel better about what we're doing, that we're able to invest to do the best we can, and nobody wants to put anything towards it. It's just frustrating to me.
people don't want to work with our people anymore. That's, I think, really hard. Back in the day, we had therapists, we had in-home workers, we had this, and now they are hard to find. We don't have any juvenile chemical dependency programs. We don't, we had more services 30 years ago than we have now. And we know more now. We know what we should do.
Well, and think about what the state did. We're going to close down mental health hospitals. Oh, the private sector will take it up. No, they're not. That is not going to happen. And in this realm, I don't believe the private sector, nonprofits, whatever, can pick up the ball and do it. And that's constantly what we hear coming out is, well, somebody will take it up. No, they aren't.
No, it's the same.
It ends up on us.
Yeah.
Always does. And if we don't deal with it, society just keeps going like this. And
It's the same thing as juvenile placements, right? They want to reduce all juvenile placements. They want to go to zero placements. There is a population of youth who need to be in placement at certain amounts of time. Well, we don't have that anymore. And it's difficult to be a juvenile agent right now. I don't know how you handle some of these high behavior kids in the community.
It seems like sometimes we're required to do what people would like to have work than what actually does work, okay? And what I wondered is, it sounds like in some ways you guys are working, trying to be psychologists, yet you don't have that training or that experience. Some you have, but not a 6-year postdoc in whatever it is. And then I also wondered, what we want to see is what works, and so we want to be spending our money towards things that there's actually evidence that it works, not what we think should work or we wish would work or any of those things. And I wonder, I'm not saying we can make this happen, but you are right that the younger you catch children, the better chance you have of having an impact on them. And certainly in metro areas, there are therapeutic preschools where all the preschool instructors are trained in trauma. They work with the families. And I sort of wonder if we're really going to spend more money, if we'd be better off spending money at the beginning and making sure we're doing something that we think would work or hope would work, but there's actually evidence that it would work. That's just my sermon for today.
Well, and there is evidence. I'm in this job because I believe people can change, and, I struggled when we eliminated, it might take the 10th time for somebody to go to treatment that it works. I still believe they should have 10 opportunities because we do not know when that is going to stick with somebody. I've seen people make change. I've seen people, drink and use for 50 years go into recovery. So I also don't think we can give up on people. Like, we have to give them those opportunities. We have to give them the skills to change. We can't say, we're going to charge you $100. Good luck in life. We need to give you the tools to be able to maintain a job, the tools to be able to maintain a relationship. We can't just say, you failed.
I'm
we're
not
gonna lock you
suggesting
up.
that, but I think even with treatment, there's factors you can identify that you can identify that say this person's ready to do it, they're more likely to do it. This person, the likelihood that the 10th time will be successful is extremely small. And of course, it would be wonderful if we had the resources for everybody, but if we don't, we want to have some way of making sure the people who are most ready to make change are given that opportunity. I'm not saying throw everybody under the bus. I'm not saying that, but I doubt that we're going to be able to do everything we'd like to for everybody.
I think our society and family structure has changed so much too that you can talk to the student or the young youth, but then they go back right into the same household, and it's
Well, it has to be,
Really
the family has
difficult.
to be involved with it. Yeah.
And I think that's what we're finding, the disconnect with families. They don't want to be involved. They want somebody else to take care of it.
anything else you'd like to say in a wrap-up here? We got just a couple of minutes, and
Thank you.
anyone else? Well, thank you, Rhonda.
Yeah,
Keep
Very
us
much appreciated.
posted.
Yep.